Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome back to my YouTube channel. I am Dr. Dada, and we are going to continue with our the most common G.I.T presentations, which is the part 5, and I'm discussing diarrhea today. So let's dive in and see. Okay, now what is diarrhea? Diarrhea is what increased in stool weight to greater than 250 gram per day, which is accompanied by increased frequency and liquidity of stool. So it's increase in stool weight to greater than 250 gram per day, accompanied by increased frequency and liquidity of stool. Or let's say if you know the amount of your stool in a day, when there is increase more than normal, this is diarrhea. And we have different types. We have different types of diarrhea. We have acute diarrhea, we have chronic diarrhea, and we are going to discuss them one by one. Now let's take the acute diarrhea. Okay, when the diarrhea is less than 2 weeks, this is known as the acute diarrhea. And the causes of this are usually the most common is infection. It can be infectious, it can be emotional, due to emotional stress, food intolerance, and drugs. So these are the causes of acute diarrhea. Now, how do you investigate patients with acute diarrhea? Investigations, we have stool analysis, we have stool culture, you do serum electrolyte, you can do also serum urea and creatinine, sigmoidoscopy. So how do you manage patients with acute diarrhea? Management. Okay, you rehydration, very important, which can be either oral or IV depending on severity. And you give antidiarrheal agents and antibiotics. Depends on the type of diarrhea and the severity of the diarrhea. So now let's see what is the chronic type of diarrhea. So when the diarrhea is more than 2 weeks. So you see the difference between acute and chronic is the acute lasts for less than 2 weeks and the chronic is for more than 2 weeks. Now, what are the causes of chronic diarrhea? We have, it can be osmotic, it can also be secretory, inflammatory, malabsorption, chronic infection, can also be motility disorders. Now, how can you investigate patients with chronic diarrhea? We have stool analysis, proctosigmoidoscopy, upper GI endoscopy, and you can do barium swallow or barium meal. Also blood tests, which can be for anemia, for electrolytes, and the rest. And management. Now, you what? Treat the cause. And you can also give things like antidiarrheal, octreotide, cholestyramine. So it just depends on the cause of the diarrhea. So you treat according to cause, you give investigations according to cause too, after proper history and examination. Okay, thank you. This brings us to the end of today's lecture. Thank you. Kindly like, share, subscribe, comment, support, and finally turn your notification button on. Turn on your notification button. This is the notification button. Okay, bye bye. So today our thing has hair. Okay, Dr. Dada.